Hello everyone, this is Rebecca, occupational therapist. This is Dementia Masters, where I teach you everything you need to know about dementia so you can master it yourself.
And in this short video, I'm going to show you how caregivers can help their loved ones reduce symptoms of dementia, reduce daily struggles, and reduce the rate of decline, while providing dignity and a sense of independence throughout the day, without arguments, extra medications, or caregiver burnout. Even if you've tried doctor's appointments, joining Facebook groups, looking stuff up online, or you've gone to physical or occupational therapy, and you still have gotten no real answers on what your loved one needs on a day-to-day basis. I'll show you what 99% of caregivers who are doing the best they can to keep their loved ones out of the nursing home and manage their daily needs are doing wrong, which causes your loved one to have increased confusion, increased frustration, and increased depression, which results in a more rapid rate of decline, increased safety concerns, and increased behaviors. And let's not forget, increased caregiver burnout. There is a better way. I'll show you exactly what to do instead with my simple Decoding Dementia Program that anyone can use, even if you don't have a medical background, you're not living with your loved one, or you think things just can't change. Since you're here on this page, it means you're likely frustrated with the lack of information on exactly what to do with day-to-day challenges. You feel helpless watching your loved one struggle and not knowing how to help. You want to give your loved one a sense of independence, and you do not want to feel like you're following behind your loved one and telling them how to do everything. You need to know why a behavior is happening and how to stop it or prevent it the next time. You hate the idea of putting your loved one in a nursing home just to be neglected, and you dread wondering if there is a better way. And you're overwhelmed by the lack of support from family, friends, or the medical world. You're feeling lost and you want to scream, "I'm trying the best I can." Maybe you've tried making doctor's appointments. Their answer is medications that only dope up your loved one, with referrals to another specialist and still no education on day-to-day needs. Maybe you've gone to support groups and got limited answers to specific questions. Maybe you've looked up Facebook groups, only to find a lot of people complaining but no real answers. You're left feeling like you want to give up, but you know you can't. You just want your loved one to continue to be safe and happy and not struggle. And you don't want the disease to be the last thing you remember. You probably feel really guilty when you get aggravated, but you just don't know what's going on and how to respond. Pretty much, you want to know what is going on and how to provide that best support. You want to feel proud you were able to give your loved one purpose and support during this time in their life. You struggle watching your loved one deteriorate and change. Ultimately, you're desperate for answers to everyday challenges. Imagine if you had the right tools to provide a positive and engaging day while limiting behaviors. Imagine if there was easy adaptive equipment out there that could make your loved one's day 10 times easier. Imagine if you could anticipate your loved one's needs. Imagine if there is an easier way to do things. Imagine if you could spend less time staying up all night listening for your loved one and more time feeling rested. Imagine if you didn't go to bed at night wondering if you can keep doing this, but go to bed proud telling yourself this was a good day. All this without having to waste time driving to another appointment, paying a copay, repeating yourself just to get minimal information and handouts. And without having people coming in and out of the house, not knowing who your loved one really is, and asking the same questions over and over again, causing more stress and confusion. You can take the steps to understanding the complexities of dementia. You can provide the best scientifically proven support you and your loved one really need. You can reduce caregiver burnout and create positive memories. You can give your loved one the feeling of purpose and personal independence throughout the day. With this information, you can teach everyone supporting your loved one so they too can provide the same positive support. If you are a caregiver who resonates with any of this, I know exactly how you feel. I have been an occupational therapist and a rehab director for over a decade. My work has focused on educating nursing homes, patients, and their families about the tools needed to understand dementia. Personally, I know exactly how you feel as well. I first saw both my grandmothers deal with Alzheimer's in my 20s, and I sure didn't know what to do then. Then I became an unexpected caregiver to my father in his 60s, suffering from diseases that caused dementia. It was my first year after graduating from college, and I thought I could handle caring for my father. I was working as an occupational therapist, so why wouldn't I know what to do? School taught me how to get the right equipment, make the house dementia safe, take his daily vitals, and get him to exercise. But I realized weeks in, I was wrong. Even to this day, I know I did things wrong. That was because it took 10 more years of specialized classes and working and learning from my patients and families. I was so overwhelmed with caring for myself, my job, and my dad's everyday needs. I was exhausted. I didn't realize caring for a loved one with dementia was truly a 24-hour job, physically and emotionally. I had poor sleep patterns because he got up and wandered around, which now I know is called sundowning. I stopped taking care of myself and I gained weight. I fought with my husband and my siblings. Some days my dad was all smiles. Other days he was lost, confused, mad, suspicious, or wanting a drink. Nobody at the time ever taught me what to say or do during these real moments of need. I tried doctor's appointments. They gave me medication to help calm him down, but it made him more confused and harder for me to care for him. I was embarrassed, but I asked other therapists and nurses what to do about his behaviors and randomness. Their mindset was for people in the nursing home. Give them exercise if they have declined, keep them on medication to keep them from getting up and around, and put the television on to keep them distracted. I have to say, this does not work. It causes increased depression, no purpose in the day, and a higher rate of decline. I was given a number to a social worker and she was helpful, but she only talked about different programs in the community and not had to deal with my dad's behaviors and real daily needs. Got home health therapy in, and they were good too, but they focused on home safety and physical progress, and still no real answers on resolving dementia behaviors. Every now and then, my dad would get sick and he'd end up in the hospital and then off to the nursing home. And all I saw him was doped up, in a wheelchair, and in a hallway, not engaging. And he was always 2 steps back when he got home. At the time, I never knew about all the different evidence-based therapies, how they helped engage and emotionally support a person with dementia and their symptoms while reducing behaviors. I was so lost there was no one real person that sat down with me and helped me understand what to say or do to limit anxiety, suspicion, or hallucinations. Nobody taught me how to get my dad to engage and give him a sense of independence and purpose throughout the day, which limited behaviors. There were times I felt so defeated, I would cry in the shower, watching him struggle and just wondering how I could keep doing this. I was angry with my brother. He would yell in frustration, trying to get my dad to understand, which just made his behaviors worse. And since I was working, I also had a hard time keeping people at the house to care for him and for them to understand my dad's needs. At times, my dad would call me at work telling me nobody was feeding him, which resulted in me spending exhausting time convincing him he had eaten. I have to say, for people in the healthcare industry, you would think that they'd be more understanding, but eventually, with all the distractions, I had to take a medical leave of absence, and eventually I lost my job. I had to stay on my toes all the time, trying to reduce his anxiety and behaviors, and trying to give answers to things that weren't really happening. I know now, with simple tools and understanding, I could have provided so much more support and created a better day for everyone. After his passing, I continued working in nursing homes. I saw families ask the same questions I had and staff struggling with behaviors. I knew there had to be something different. I knew if I had a hard time, then everyone else is having a hard time as well. Fast forward years of certifications and learning all the different evidence-based therapies that really help people who are dealing with dementia symptoms. I created a simple Decoding Dementia Program for patients, families, and staff. After a year of implementing these strategies, 2 years in a row, the nursing home was awarded 5 stars for reduced falls and anti-anxiety medication. They had increased staff and family satisfaction, and perhaps most fulfilling of all, they had increased patient participation, personal engagement, and reduced behaviors. And my success can ultimately be boiled down to my simple Decoding Dementia program. When COVID hit, the nursing homes, all my hard work went down the drain. People were left isolated, staff was inconsistent, and therapy was the last priority. I knew I had to bring my program to people who heard the horrifying things about nursing homes and wanted to keep their loved ones home but didn't know what to do. 3 common mistakes with dementia care, because without fixing these mistakes, no step-by-step process in the world will solve your problems. Mistake number 1, the nursing home is better equipped than you. Please don't think that. Don't think anybody's better than you. The nursing home is not better equipped. The nursing home costs about $15,000 a month, and that's sharing a room with a stranger. And they have minimum staff requirements. Like in Massachusetts, for every 25 patients, there's 1 CNA, and in Texas, the rule is up to the nursing home. So they have no rule. And since COVID, staffing is at record lows and turnover is really high, limiting personal attention and understanding of your loved one's needs. There's a higher level of neglect, higher levels of medication usage, and a quicker decline. And some states don't even require dementia education, while others require about 2 hours a year. Versus care at home, there's decreased medication, decreased depression, decreased spending, and less worry about abuse and neglect. And there's increased levels of engagement, higher level of attention, increased personal autonomy, increased memories, and a lower rate of decline. By learning and understanding dementia, you can feel better knowing that you can do a better job than paying a nursing home $15,000 a month and worrying about depression, neglect, and a quicker decline. Mistake number 2 is that you cannot limit or stop behaviors. You can limit and stop behaviors by understanding what dementia does to the brain and using easy strategies to assess what's going on. For example, I'm going to tell you a couple stories of some people that I've worked with. Beth is a woman who contacted me because she had brought her mom into her home from a couple states away and started taking care of her. And her mom just kept going to the door and trying to get out. She would go to the windows and always be peeking out the windows. And Beth was worried about her mom. She learned and looked up all the things she needed to look up by trying to provide distractions, by giving her movie nights, trying to keep the door closed. She even put the couch in front of the door. But all this did was get her mom angry. Her mom would be angry and yell at her and not make the situation any easier. And so after I worked with Mary and Beth, we were able to assess why her mom was trying to leave. We were able to create a dementia-safe environment with adaptive equipment. We were able to implement specific activities to reduce sundowning, wandering, and her behaviors. And Mary's daughter was so relieved she knew what to do throughout the day, what to say, and how to react to reduce the behaviors. She told me the days were so much smoother, and now they are able to create better memories. So you can limit and stop behaviors. And another thing that you can do is remember that a behavior is a reaction or a form of communication. So I was going to tell you about Mike and his parents. Mike contacted me because his father had just come from the nursing home, and after a fall from getting the mail, and he was diagnosed with vascular dementia. And Mike did see that his father was declining, but didn't know what to do, and his mom was helping, so it wasn't that big of a deal. But Bob and his wife just kept fighting all the time, and he kept refusing to shower. So she had to call in Mike and ask him, to come in and help his dad with a shower and try to do something about it. And Mike wasn't able to do anything about it. His father refused him. And so after going through my program, Mike learned how to communicate at his father's current level and was able to assess why he was refusing. And I was able to suggest adaptive equipment to change up the bathroom, change the communication style to get him to agree, ways to communicate to the steps needed to complete the shower, and still giving him a sense of independence and reducing his anger. And Bob and his wife were still arguing about little things. Mike was able to teach his mom better ways to communicate and understand and assess why Bob was angry at the times. And Mike told me his father still gets angry at times, but is able to assess the situation and figure out what is going on. He was also able to teach the CNA how to say things and do things to get Bob to participate more. And we have to remember that dementia is not just about losing memory, but it's about misconnections in the brain. Bob had lost his ability to communicate effectively, causing angry outbursts. Bob felt embarrassed about what was going on with him, and Bob was depressed, losing his independence. The dementia symptoms Bob had were causing changes in his balance, his vision, taste, controlling emotions, physical abilities, and much more. So dementia is not just about losing memory, it's about losing a lot more than just memory. My next example of being able to stop or limit behaviors is if you can assess what's going on and you know what your loved one's history is about, you can communicate and limit behaviors from happening. So I'm going to tell you about Evelyn. Evelyn was in the nursing home and she kept getting up and down all times of the hours, forgetting her walker, looking around the nursing home, looking around in other people's rooms, drawers, everywhere. She wouldn't sit long for meals and she would refuse any activities and she refused to come to therapy with me. And everybody was afraid she was going to fall. She ended up coming to the nursing home because her son was afraid she was going to fall, and she was up getting around and she was falling at home. So for me, I was going around with her, and one day her son showed up, and finally I was telling him what we were doing. I was trying to figure out what she was doing, moving around and looking for something. And he asked her, "Ma, what you doing?" And she said, "I'm looking for Stan." And he said, "Stan's dead, don't you remember?" And at that point, I didn't know who Stan was because I didn't know anything about her history. And her son went on to tell me about how Stan was a son that she had had before he was even born and had passed away before he was even born. And at the time when he said, "Don't you remember?" she looked up at him and was very angry and said, "Who are you? Get out of here," and just kept pushing and swishing him out of her room. And you could see that he was hurt by the situation and didn't know what to do. And for the rest of the day, she was upset. She refused to do anything. She just kept mumbling and just was not happy. So the next session that I saw her, I had gotten a doll, a male doll, and I put it into one of the chairs that she usually went around and peeked around with. So she found the doll and she just was so happy to find the doll, and she said, "Oh, I found Stan," and she was happy and delighted. And we were able to put a basket in front of the walker, and she started using the walker. She started going to therapy sessions. She was able to go to meals and sit with meals, and this gave her a purpose. And it was great. After knowing Evelyn's personal history, I was able to create a safe environment, adaptive strategies, limit anxiety and behaviors, and increase participation. And the thing with the doll is that sometimes, I gotta say, she would look up at me and say, "Stan's really a doll." And I wouldn't know what to say, but she kept going with it and she enjoyed the doll. So one of my biggest things that I could tell you is helping your loved ones stay in the moment that may not be real to us, but it's real to them, is key to lowering to their stress and their anxiety and their behaviors. So Evelyn's son came to a support group, and I discussed with him about understanding about being in the moment with his mom. And we also implemented more strategies that he could use to create memories and help his mother recognize him the next time. And he was so thankful for this information because at first he was against any type of thing making his mother feel immature, but he saw how happy she was in the moment and how she was moving around with the walker. And so that part is the most important. And one of my biggest sayings is, if it's not physically or mentally hurting them, or others, then let them be happy. Let them be where they are and let them be happy. The next mistake that we seem to have is that we think sometimes that they are doing this on purpose. And I'm going to tell you a case study about myself and my father. And I had plenty of these, but here's one incident that I'm going to tell you about. My brother had found a friend who could cover some hours when I was at work. She didn't know much about dementia, but she took care of her mom in the past, so this is what I needed. And I got a frantic call from my brother, freaking out, telling me that I had to get home and that he couldn't handle my dad and that everyone was yelling. And my brother said that my dad was being a pervert and that the CNA, or the person he had hired, wanted to quit. And so I came home to them yelling at each other, and I couldn't figure out what was going on until we all calmed down. And what had happened is that the caregiver, she had found my father, peeing in the sink. She found his pants around his ankles and his things out, and he was peeing all over the sink and the ground. And she just thought he was being a pervert and wanted to get out as quick as possible. And after everybody calmed down, I was able to assess that my father was doing. He was looking for where the bathroom was. He was looking for what was going on. I had moved his stuff downstairs in his house that he had lived in for over 36 years. And so his bathroom was in a different area than he was used to. I brought his bed downstairs and I made a bathroom out of a closet. And it did the job, and I would bring him to the bathroom and I walked him. But when I left him with the caregiver, I didn't explain to her that this might be a new environment for him because it had been months. I put the commode at the end of his bed and I put a urinal attached to his side rail, so I figured things would be fine. And at the time, that wasn't. The mistakes that I had made is that I didn't change his living area to be dementia friendly. I should have told the caregiver about his environment had changed, and I should have put up adaptive strategies like signs around the place or something that would have helped direct him to the bathroom. But I didn't know these things. And my father's behavior was not being a pervert or doing it on purpose. He had urgency. His history included bladder cancer, so his urgency was really urgency. And he didn't want to have an accident and be put back into what I call hospital underwear, he called diapers. And he didn't want to go on the floor. So I say almost kudos for him. He was figuring out where he could go, and that's where he ended up. And if I had known these things, I would not have had to deal with another stressful moment. My brother would have been more tolerant and willing to help. My father would have not been upset with himself and everyone else, and I would have been able to keep the help that I had. So, now if you're making any of these common mistakes, and if you want to get real answers to daily dementia challenges, and you want to provide a calm and supportive environment, you're probably wondering what you should be doing instead of arguments, questioning, and medications, and what this Decoding Dementia program is all about. And most importantly, how will my simple strategies work for you and your unique situation? Well, you're actually seeing this page at a very opportune moment. I have some availability on my calendar for the next couple of days, and I want to give you a chance to book a call directly with me. On this call, I'll share with you how this process works, how I do it, but more importantly, we'll talk about your specific situation and how we tailor this program to your specific needs. And I'll help you determine if my Decoding Dementia program can help you create a safe and supportive environment with reduced behaviors and decreased caregiver burnout. We'll talk through what the strategies would look like for your specific needs. If this process looks like a good fit, I may let you know about my coaching programs and how it works and what's involved. And if it doesn't look like a good fit, I'll let you know that too. I respect your time and don't want to lead you down the wrong path. Regardless, you'll get a ton of value and clarity on this call for your situation and how to move forward, increasing your confidence and creating a dementia-specific approach while reducing behaviors. I look forward to speaking with you and getting to know you and your situation. And we will see if joining this program is the right next step for you. Now, you might be wondering why I don't give you the Decoding Dementia tools right here in this video, and the answer is simple. Each family situation is unique, and I don't want to give you a cookie-cutter approach. In order for this simple program to be most effective, it needs to be tailored to your exact situation and needs. So click the button below this video and book a free breakthrough session with me. We'll talk through what steps would look like and for your situation. If it does look like a good fit, I may let you know when my program opens up and how it works and what's involved. And if it doesn't look like I can help you, I'll let you know that too. Regardless, you'll get a ton of value and clarity on this call for moving forward in supporting your loved one. So I look forward to speaking with you and getting to know your situation. And we'll see if joining the program is the right next step for you. So here's what you need to do right now. There should be a button on the page below this video. So go ahead and click that button right now. I don't have much space on my calendar, and I take a limited amount of people to keep things small and personal. And this video is only going to be available while there are spaces available, Once the calendar is booked up, the video comes down. And there's a good chance my calendar will be booked up before the end of the day. My last group booked up in 2 days. I don't know how many people are watching this video, so I wouldn't put this off. If you have been struggling to make caregiving easier and have been needing to get answers to everyday challenges for a while now, you've got to do something different because what you've been doing clearly isn't working, otherwise you wouldn't be here watching this video. You can't just go back to distractions and arguments. You can't go back to thinking this is the only way. And you certainly can't go back to wanting to give up each day. Your transformation is all going to start with this one simple phone call, and I'll show you exactly what to do. I'll even give you an opportunity for me to help you create a personalized approach and implement these simple strategies if you're a good fit for our coaching program. So you can finally feel like you truly understand what your loved one with dementia needs and provide the right support. So I want you to click on this button right now. Don't miss this opportunity. Click the button, book your call on the next page. On the next page, there'll be a short form you'll need to fill out. It's necessary for me to know your situation a bit before our call so I have a better understanding of your needs, which will allow us to get the most out of our time together. So I hope this has been insightful. I hope you're excited about finally going in the right direction, because that's exactly what's going to happen on the other end of this call. Click the button now, book your call, fill out the short form on the next page, and I can't wait to speak with you very, very soon. Have a good day and keep fighting the good fight.